Hi there, everyone. I am Dr. Nancy Handler with Mind and Mood Mental Health. I am located in Omaha, Nebraska, but I provide telemedicine services and serve patients all over the state of Nebraska. So, I am here today to discuss a bit about what to expect during an initial appointment with a psychiatrist. I see a lot of patients who have never seen a psychiatrist before, and it can be helpful to put your nerves at ease a little bit, knowing what to expect when you come in for your first appointment. So, I'm going to start just telling you a little bit about me. I am a psychiatrist. That means I'm a physician. I attended 4 years of college, followed by 4 years of medical school, and then chose my specialty of psychiatry and completed 4 years of residency in adult psychiatry. I then did some additional training in women's mental health as well. So, when a patient calls and is wanting to set up an appointment, we start first with a 15-minute phone call. It's complimentary, just to talk to one another and get an idea of if this might be if this is a good fit for you. I can answer questions at that time. There is a questionnaire that is required before that 15-minute phone call that just gives me a little bit of information about where you're coming from, and I'm able to review that before we talk. Then during that 15-minute appointment, we will set up your initial intake. It is blocked off for an hour. Some people use the entire hour. Some people don't use quite that much. And some people would like a second intake depending on how far we get. So during that first appointment, I have already reviewed a lot of paperwork. There are some questions that I send you ahead of time with a variety of questions. Then during the appointment, we'll make some verifications on those, if there are any clarifications that I need going through. During that time, we also take a look at symptoms that are going on that may clue us into a diagnosis. I see a lot of patients who have depression, anxiety, postpartum depression or anxiety, ADHD, mood disorders, a variety of things, trauma, PTSD, and from there we can make a working diagnosis. We look at also a lot of family history, medical history, mental health history, and also, of course, your history as far as those things go too. We then take a look at your social history. That is helping me learn a little bit about what your life looks like, if there are people you live with, what your relationships are like with them, those sorts of things. We look at substance use history, relationship with drugs and alcohol, smoking tobacco, those sorts of things. We then, kind of as we near the appointment, we usually have a working diagnosis based on the information that I've collected. We are often then starting a medication. It's, of course, up to you and I working together, and I kind of follow your lead with some of that when I'm making a determination of what the plan will be and if there's a certain medication that might be best for you. We'll then start that medication. We start low, go slow, making sure that we are not prescribing more than we need, but of course wanting to control the symptoms that you're having. We then schedule an appointment about 4 to 6 weeks after that initial appointment. That allows us to ensure that your body is tolerating the medication that we started, and in some cases often is having an effect. We wait about those 4 to 6 weeks just to give the body time to absorb that medication, making sure we give it a fair trial during that 4 to 6 weeks. From there, we usually have another appointment. Medication management appointments are shorter. We will decide together if the medication is working, if at least you're tolerating it well. We will then either increase the dose, stay the same on the medication, look at it, adding in another medication, or changing the medications altogether. But I think it is fair, and usually I do like to give the medications a fair trial before we jump ship. We then see one another and we continue to have medication management appointments. And as we get closer to a regimen that we like, we are able to space those appointments out further. And usually that's about every 2 months or so that we're seeing one another once things are stable. So that is a little bit about how the first appointment goes. Again, I want to talk a little bit more about that 15-minute initial appointment. So anyone is welcome to go to the website. There are some links on the pages that say free 15-minute phone consultation. You can click on that and we can schedule a time for that 15-minute phone call. There are a few questions that I like to have before those, just to know a little bit about where you're coming from. But during that appointment, we then schedule the initial intake. So I am happy you're here, you're watching. That's often the first step in getting some help. And again, I am Dr. Nancy Handler with Mind and Mood Mental Health. I am happy to answer any questions, phone call, email, anything like that. So anyways, have a great day, and I hope to hear from a lot of you soon. Thank you.